breast cancer is a concern for everyone in the medical field, including dentists, because it's linked to poor oral health and gum disease.
Yes, and joining us now is a registered dental hygienist, Anastasia Turgetta.
Thank you for having me.
Yeah. And Anastasia, I didn't realize this until I was researching the story and talking to Missy, who is now a cancer survivor. You know, we're so proud to have her as the co-host today, but you dealt with quite a few dental issues.
Yeah, so after my treatment in July, I decided to go to the dentist because obviously while you're going through treatment, you can't. And I had to get 2 crowns. And I've been fairly healthy and done all my checkups and done everything. But yeah, I had to go in and get 2 new crowns.
It's amazing. You know, first of all, I applaud you for going back in. And what we don't realize is once you are diagnosed with breast cancer, it's really important to visit your dental hygienist. And here's why. We have to assess your current state of oral health. What do we restore? What do we maintain? And what can we prevent to help keep you healthy with the extent of oral health side effects that will happen with chemo and radiation?
Yeah, Missy's doctor was actually, or dentist I should say, was kind of shocked that she was only dealing, right?
With 2 crowns, yeah. And it was just the very back teeth. So all my other teeth were really, really healthy. So I was very blessed.
You're very blessed, yes.
Because what else could happen?
You know, it's a great question, Gail. I mean, you would be surprised at how many, it's like layers, right? It's multifaceted. But there are 2 things that stand out for me. Oral mucositis, which is basically mouth ulcers. So it kind of looks like it's a red dot with a little white halo, but there's nothing angelic about it. It's severe pain. So severe pain with eating and then also with keeping up with your oral hygiene regimen. The second one that stands out is Xerostomia, and that's dry mouth. And we take for granted our spit. I mean, our spit is it. I mean, you gotta love healthy spit. It's antimicrobial, it's antifungal, it helps us start to digest when we eat food, it helps us swallow, it helps us speak, and without it, it leaves a chapped lip or cracked lips. Your voice is hoarse. It can increase your risk for tooth decay. It doesn't keep your oral health tissues moist, if you will, and then it also contributes to bad breath.
Yeah. We see you have a few props there. What do we need to know?
Yes, you know what's amazing for me, what I would recommend to my patients who were going through breast cancer treatment even after, you can never, I mean, soft bristle toothbrush, hands down. So I want to do a little test with you. They're not all the same. So this one is a soft bristle toothbrush. So what I'm going to do is just kind of rub it here so you can feel that.
Yes.
Soft bristle toothbrushes have about 2,500 bristles. This one, now this one is one I use for myself. This one's got 5,460. Oh, wow. But the one I would recommend has 12,000 soft bristles. So when you're dealing with dry, irritated tissues, it's very important to ask your dental hygienist what to get instead of getting something that does feel very different. Think of it as a thread count. Right?
Yeah, like
you want a
sheets.
higher thread count.
Absolutely.
Yes.
So could you just sashay into your drugstore and get a 12,000 count toothbrush?
Sometimes you can, but it's better to ask your dental hygienist which one to recommend, because sometimes around here you may not be able to find it. So where do you go? You don't even know what to search for if you go on, you know, if you Google, you go on, you know, other shopping places. So it's really important because we get educated. Our continuing education helps us with dry mouth. It helps us to find, you know, ingredients in mouth rinses such as xylitol. Or if you're having pain with eating, you might want to get a prescription mouth rinse that has something that's got a numbing agent in it.
And all of those are very important going through chemo because I remember I got ulcers really bad and those toothbrushes would have been amazing.
It's so helpful because, you know, it is a fitness regimen, but with your oral hygiene, think of gentle. Everything has to be very gentle when you're going through breast cancer treatment and even for the weeks and months afterwards.
Amazing things that you don't even think about. All right, Anastasia, as always, thank you so much for joining us.
Thank you for having me. I really appreciate it.
Absolutely. And I'll connect you with Anastasia on our website, WFLA.com/Bloom.